So, good morning, everyone. So, after the enlightening session on lifestyle medicine, now we will be talking about evidence based nutrition. So, these days it is all about evidence based practice. So, we need strong evidence to back what we are guiding our patients. And of course, we also need to make a choice for ourselves. So, today we will be running through a few studies. But before that, let us look at this pyramid, which is the hierarchy of evidence for nutritional science. So at the base, we see their animal and lab studies and case reports, case series, expert opinions. So these are not really considered very good, robust evidence because they are right at the bottom. In the center, we see observational studies and randomized control trials, which are the unfiltered or primary studies. And when well planned, these give us a lot of good evidence to support what guidance we are going to give. And at the top, we see meta-analysis and clinical practice guidelines, which are filtered evidence or secondary evidence. And as we go higher up in this pyramid, the quality of evidence improves. So let us look at a few studies which see overall chronic lifestyle conditions. So coming to nurses' health study, which Dr. Smriti mentioned in her talk. So this study was a prospective cohort study started at Harvard, and it started way back in 1976. And they looked at nurses from almost 11 states of the United States. And this went into many phases, and it is still ongoing. And they collected a lot of information on nutrition as well as other lifestyle factors. And they saw how it was affecting the chronic conditions in women. So mainly nurses were women, and now even male nurses are enrolled in this study. And this study has given almost 1,200 publications and has influenced guidelines of American Heart Association, American Cancer Society, and many more. So let us look at the key findings specific to diet. So the study found that obesity was increasing the risk of almost all the chronic conditions, such as breast cancer, especially postmenopausal, then cardiovascular disease, stroke, colon cancer, as well as eye diseases. And they found that diet rich in red meat was increasing the risk of premenopausal breast cancer. They found that a Mediterranean diet, we'll see later what that contains, fish, nuts, and whole grains, when they were included more, they reduced the risk of cardiovascular disease and stroke, whereas refined carbs and trans fats were known to increase the risk. A diet rich in folate, vitamin B6, calcium, and vitamin D was helpful for reducing colon cancer risk, whereas red and processed meat was increasing colon cancer risk. In women with already low calcium in their diet, obviously, vitamin D and calcium supplementation was helpful to reduce fractures. And cognitive function was most maintained in those consuming a good amount of vegetables, especially green leafy vegetables. And more consumption of antioxidants and fish caused reduced risk of cataract and age-related macular degeneration. So we see a clear pattern emerging here, where the devils are the red and the processed meat and the refined carbs and the trans fat. And what we need to include more are nuts, whole grains, and green leafy vegetables. Coming to this second study, the EPIC Oxford study, this was also a prospective cohort study, and they divided the subjects into 4 groups: meat eaters, fish eaters, vegetarians, and vegans. And the fat percent in each of their diet was kept the same, around 33% energy from fats. And what they found was, this is a chart showing the relevant findings. So they found that the meat eaters were eating about 10 to 11% of their energy as saturated fat. Whereas the vegans, that means the plant-based eaters, were having 5% of their total energy as saturated fat. Fiber, B1, folate, vitamin C, E, magnesium, and iron was the highest among the vegans, whereas the vegans struggled in B12, D, calcium, zinc, and retinol. So when we want to increase our plant quotient, when we want to go more on a plant predominant diet, we need to be careful that we are taking enough of B12, D, retinol, calcium, zinc in our diet. They also found that obesity was highest among meat eaters. The meat eaters had a higher BMI, whereas the vegetarians and vegans had a lower BMI. The risk of type 2 diabetes, pre-diabetes, and a deranged lipid profile was highest among meat eaters, and it was lowest among vegans. Also, 12% lower risk of overall cancer among vegans and vegetarians together. So this clearly shows that more plants in your diet, the better your outcome for chronic conditions. Okay, so a quiz time now. As per DASH diet, what is the daily intake of sodium and sodium chloride, that is our table salt, to maintain a healthy BP? Okay. I'll just point out, and yes, madam, you want to say B, 1.5 grams and 3/4 teaspoon salt. Anyone else with a different answer? Yes, sir? No, can you be a little louder? D. D, 1500 milligrams, but 3.75 teaspoon salt. Okay, so I'll tell you the right answer is B, 1.5 grams sodium and 3/4 teaspoon salt. So, madam, your name, please. Yeah, thank you. Thank you.
Just a request, please don't blurt out the answer, you will not get the prize. So, raise your hands and the speaker will point out, then only you answer. So, it's fair for everybody.
Yes, so we'll look why that is so in the subsequent slides. Yes, so now we look at a few studies which are based on looking at risk of hypertension, cholesterol, and both together convert to risk for cardiovascular disease. So this is the study which reviewed the DASH diet. Now it is a multi-site, parallel, randomized control trial where they divided the subjects into 3 groups. The first group was given a control diet with 35% calories as fat and 14% calories as saturated fat. So that's quite a lot, and that usually is comparable to the standard American diet. We call it SAD, standard American diet. Fruits and vegetable diet had similar fat, 35%, but the saturated fat was less, 12%. And a combination diet, which was fruits and vegetables along with a lot of other nutrients, so rich in potassium, calcium, magnesium, and they had lesser saturated fat, 7%. And what they found was, they found the combination diet reduced the BP just within 2 weeks. And this benefit persisted over the next 4 weeks. And this was independent of whether the candidates lost weight or whether they were exercising. So just the diet was impactful, irrespective of sodium or alcohol, because here they kept the sodium the same, 3 grams per day. But later they found that reducing the sodium even further to 1500 milligrams, that is 1.5 grams per day, was even more beneficial for BP. And the DASH eating plan came up because of this study, and that is you need to have more vegetables, fruits, and whole grains in your diet. That is unprocessed, unpolished. We need to have more of beans and nuts and fat-free or low-fat dairy products. So the key word here is low-fat or fat-free. So we need to reduce our fat intake. We need to reduce our saturated fat intake. And also, sugar-sweetened beverage and sweets need to be reduced because these are refined carbs. Looking at Harvard Health Professionals follow-up study, this was also a prospective cohort study which looked at nutritional factors on men's health. So it started as a parallel to the nurses' health study, nurses, women, health professionals, men at that time. And the key findings were that they found that limiting sodium and increasing potassium improved cardiovascular health. They also found that more phytoestrogens in the diet, that is more through plant predominant diet, the overall all-cause mortality reduced. Then when they replaced fat with avocado, again a whole food, although fat-rich, but along with the fiber, minerals, so they found there was reduced risk of cardiovascular disease and coronary heart disease. And also whole grains were beneficial to reduce the risk of heart disease. A healthy plant-based diet, that means as whole as possible, minimally processed, has all the main key components, that is whole grains, beans, legumes, vegetables, green leafy vegetables, fruits, nuts, plant seeds. So the healthy plant-based diet had an inverse relation. So it reduced the risk of heart disease, whereas an unhealthy plant-based diet increased the risk. So just plant-based is not enough. It is important to have a healthy plant-based diet. Red meat, when replaced with plant protein, reduced the risk by 14 to 17%. Also, sugar-sweetened beverages, red meat, and animal fats and margarine were going to increase the risk of heart disease. Then lifestyle heart trial by Dr. Dean Ornish. Dr. Smriti explained it beautifully. I'll just quickly run through it. Dr. Ornish divided the participants into two groups. Control group who received the regular treatment and an intensive lifestyle group who was predominantly given a 10% fat containing whole food plant-based diet along with other lifestyle factors, exercise, stress management, sleep, smoking cessation. And they looked at the coronary artery diameter and they also looked at cardiac events in the entire subjects. And he found that in the intensive group, the coronary diameter improved, became bigger at 1 year and continued to improve over the next 5 years. Whereas in the standard treatment, which is usually the norm, the coronary diameter reduced and continued to reduce. So here it is worthwhile to note that having more plants and having more whole food and less fat percent in the diet is going to improve or even reverse coronary atherosclerosis. And the cardiac events, that is the myocardial infarction, stroke, or even sudden cardiac death, also was almost twice in the standard group or the control group, whereas it was just less than half of that in the intensive lifestyle group. So this gives us a lot of key points as to what our diet should be. Dr. Caldwell Esselstyn. Dr. Smriti again mentioned him. He had this wonderful program, he still continues to have it, for controlling and treating coronary heart disease. And his cohort of patients who are on a whole food plant-based diet, obviously with minimal fat percent, they showed a cholesterol reduction from 246 to 137, quite substantial. There were no cardiac events in the patients enrolled with him, even up till 12 years post-enrollment. And his angiograms were showing a substantial improvement. All the angiograms were excellent. Here, just a couple of them to give us an idea. The right coronary artery, which showed a blockage after 60 months of a plant-based diet, needless to say, a healthy plant-based diet, showed a 30% improvement. And on the right side, you can see the left anterior descending artery, which is so poorly perfusing, and it opened up in 32 months of a plant-based diet. Coming to the Omni heart trial, which also looked at the macro content of the diet. So they divided the participants, and these participants had pre-hypertension or stage 1 hypertension, and they were divided into 3 groups. The first was a carb-rich group, the second was a protein-rich group, and the third was an unsaturated fat-rich group. So look at the fat, it is unsaturated fat. And they kept the calories the same. So when the calories were same, obviously they had to adjust the macros such that the carb group was taking 4.6 desserts per day. How lovely, na? And the protein group was taking 2.5 and unsaturated fat group was taking 1.7 desserts per day. And they found that the protein-rich and the unsaturated rich fat diet groups showed a benefit in their BP as well as their serum cholesterol. So this translated to a reduced 10-year risk of coronary heart disease compared to the carb-rich group. And why was this happening? Because obviously in the quest to maintain the calories same, the carb-rich group had taken more refined carbs. So again, we want to reduce refined carbs and we can take whole unprocessed carbs. So carbs is not the enemy. What type of carbs is important? So these are the general diet tips we tend to get from the Omni Heart trial. We need to increase our fruits. So 1 to 2 servings of fruit at every meal if possible. At the beginning of the meal rather than at the end. 2 to 3 servings of vegetables at lunch and dinner. A dried fruit and nut can be used as a snack. Fat-free and low-fat milk, again, fat-free or low-fat is the key word. whole grains instead of refined grains, and lean meats and poultry. So the keyword here is lean. That means we want to take out the fat. In animals, it is mainly saturated fat. Again, the 7 days of ad libitum low-fat vegan diet. This program was conducted by Dr. John McDougall, and he enrolled almost 1,600 participants in his residential dietary intervention program, gave them a diet of whole food plants, plant-based diet, a high carb content. 80% of energy was from carbs, but a low fat, less than 10% energy was from fat. A moderate sodium diet, and it was ad libitum. That means the candidates could consume as much as they wanted. And the results at the end of just 7 days were quite remarkable. The participants lost a median weight of 1.4 kg. The cholesterol reduced by 22 milligram percent in just 7 days. Both systolic and diastolic BP reduced. And the cardiovascular event risk that is calculated over the 10 years, it reduced from 7.5% to 4.5%. So, sorry, 5.5%. So this is quite remarkable considering the intervention was only done for 7 days. So imagine when we continue to do this intervention on a longer basis, we are definitely going to reap much more benefit. Looking at Predimed trial. So this was for primary prevention of heart disease. So they picked up individuals who did not have existing heart disease, but who had a high risk of developing cardiovascular disease. That means they either had type 2 diabetes or they had any of the high risk factors, that is they had smoking history, hypertension, a high LDL or a low HDL, they were either overweight or obese, or had a family history of premature heart disease. And they found that obviously these participants, they divided into 3 groups. One was Mediterranean diet with olive oil. The second was Mediterranean diet with nuts. And the third was the standard diet where they were just advised to reduce your fat. And they found that the major cardiovascular events were 30% less in the Mediterranean olive oil group and 28% less in the nuts group. So needless to say, the Mediterranean eating pattern is beneficial for heart disease prevention. And what is a Mediterranean diet? It has olive oil, fruits, nuts, vegetables, and cereals, mainly whole grains. It also has moderate intake of fish and poultry, not a lot, moderate. It has low intake of dairy products, red meat, processed meats, and sweets. And they consume wine in moderation. So this kind of gives us a pattern what we need to choose to increase our nutrient quotient as well as reduce our risk of heart disease. Coming to obesity, this trial was conducted in New Zealand, the broad study, where they implemented whole food plant-based diet along with B12 supplements in the community. And they looked at markers for obesity, ischemic heart disease, and diabetes. And they had 2 groups. One was the control group and one was the whole food plant-based diet. And they found that the whole food plant-based diet group reduced the BMI by 4.24 versus the control group by just 0.4 in 6 months. They also found that the total cholesterol reduced in the whole food plant-based diet group. So clearly, the whole food plant-based diet is beneficial compared to the conventional diet that is generally had. So again, the second quiz question now. So according to you, what will lead to the least consumption of calories when given ad libitum? That means uncontrolled. And all these diets are minimally processed. Okay? So high protein, high fat, low carb. Yes, madam? Low fat. Anyone has a different answer? D, low carb keto diet. Anyone else? Yes, madam? B, high fat. Okay, so someone says A as well. Right. So the correct answer is C, low fat diet. Yes? Sir, madam ka naam le lo, please. And we will see why that is so. The question is least consumption of calories. Okay? So these are a few experiments conducted by Kevin Hall, and he conducted metabolic ward studies, wherein he admitted patients as inpatients in the hospital ward, and they were given a controlled diet, and these patients underwent multiple testings even in metabolic chambers. So the first study that he published was in 2015, where he gave 2 different types of diets to 2 groups for 2 weeks. And then he switched the diets. And the findings were, and this especially was in obese patients, and he was looking at fat loss. So the patients who were on a low-fat diet showed more fat loss compared to patients on a low-carb diet. The calories were the same, okay? But same calories, low fat is more efficient for fat loss compared to a low-carb diet. In 2019, he did the same experiment with 2 groups. One group had ultra-processed foods, and the other group had whole, minimally processed foods. And there, the macros were matched, okay? So the carbs, protein, fat, fiber, the sodium, the sugar, the calories, everything was kept the same. The patients were given these foods, and they were asked to eat as per their satiety, ad libitum. And he found that the ultra-processed food group was consuming 500 calories more per day and gained 0.9 kg weight over 2 weeks. Whereas when he switched, the same group, when they took minimally processed foods for the next 2 weeks, lost 0.9 kg weight. And why is that so? Because even if the fiber is the same, even if the macros are the same, the ultra-processed foods will have more of refined carbs and added fiber, which does not work the same as the natural fiber in the whole foods. So whole foods are more satisfying, and like Dr. Smriti said, you cannot overeat on a whole food diet. And that is why the ultra-processed food group ended up consuming more calories. And this was the last experiment that we will discuss. Here, Dr. Hall discussed 2 diets, a low-carb, high-fat diet and a low-fat, high-carb diet. So 20 adults were admitted inpatient and were given ad libitum diet, again for 2 weeks and switched. The low-fat diet was from plants, minimally processed plant foods, just 10% from fat, 75% energy from carbs, and a high glycemic load, 85 grams per 1000 kilocalories. But even if the high glycemic load, the type of carb is unprocessed or whole. Whereas the low carb, high fat diet, so low carbs means just 10% carbs, 76% fat, and a very low glycemic load, so mainly from minimally processed animal foods. And he found that the low fat diet group, that is the low fat, high carb, high unprocessed carb group, was consuming 690 calories less per day. Why? Because the fiber in the whole carbs is more satisfying compared to the low carb, high fat group. Again, coming back to the picture, if all of you remember, which Dr. Smriti shared, the stomach was hardly filled with 500 calories of oil, which is just a few ml, whereas it was completely filled with fruits and vegetables. So again, a low-fat diet is going to give less calories, and it's going to be more satisfying provided the carbs are unrefined. Coming to a few studies for type 2 diabetes. This is a diabetes prevention program. So they took 3,000 odd individuals who had impaired glucose tolerance but did not have diabetes, and they put them in 3 groups. The first group was given an optimal diet of less than 30% fat, less than 10% saturated fat, less than 300 milligrams of cholesterol. The other group was given a diet which made them lose more than 7% weight, less than 25% fat in their diet, and regular physical exercise. And the third group was given metformin, 850 milligram twice a day. And they found the type 2 diabetes incidence in 100 years was 11 in the placebo group, 7.8 in metformin, and the lowest, that is 4.8, in the lifestyle group. So lifestyle modification, that is weight loss, in obese individuals with regular physical activity with a low-fat diet is twice as effective as metformin in preventing progression to type 2 diabetes. This is an Indian study by Sarathi and the colleagues. And they found that high rates of diabetes reversal is possible in newly diagnosed young Indian type 2 diabetics. So they took 32 patients and put them into 3 groups. All of them were given lifestyle modification. That is a low-calorie diet of 1,500 calories per day with 60% carbs, 15% protein, 25% fat, along with 1 hour of brisk walk every day. And they found, so those with HbA1c less than 9, newly diagnosed with lower HbA1c, were only on lifestyle modification. Those higher HbA1c were put on metformin as well, and those who had infection were given insulin as well. So they were given lifestyle modification along with conventional therapy, and they found that those, and obviously they downgraded the medications once the HbA1c reduced to 6.5 or below. And they found that at 3 months, 75% of these individuals went into remission. So went into a HbA1c were below 6.5. At 1 year, all the 75% continued to stay in remission. And at 2 years, a major chunk, 68.75%, continued to be in remission. So overall, by a healthy lifestyle, newly diagnosed diabetics can be maintained without antidiabetic medication or with minimal antidiabetic medication. That is clear from the study. Coming to this second study by Dr. Pramod Tripathi from Pune, he enrolled patients into their intensive lifestyle program where each patient was given a customized healthy vegan diet. So vegan is the word used in Dr. Tripathi's publications, but for our purposes, a healthy vegan diet is a whole food plant-based diet. Regular physical activity, stress management, along with conventional medical management. And he found that all the participants improved in their HbA1c, in their weight, and almost 30.3% participants achieved remission. Those who achieved more weight loss, so more than 15 kg weight loss, were more likely to go into remission. That is HbA1c less than 6.5% without any antidiabetic medication. And those who had a newly diagnosed diabetes, less than 10 years duration, were more likely to go into remission. So more the weight loss, more likely remission. Earlier the diabetes, more likely remission. Coming to cognition, Dr. Dean Ornish has published this wonderful study which Smriti mentioned on intensive lifestyle therapy in patients with mild cognitive impairment or early dementia. He found that the cognition and function tests improved substantially. The beta amyloid 42:40 ratio also improved, and the gut microbiome also improved in these patients with early cognitive impairment who were on a whole food plant-based diet along with the other positive lifestyle factors. Coming to cancer, the Geminal study, 30 patients with low-risk prostate cancer were enrolled. These patients had refused conventional therapy and they were enrolled into this study. Biopsy was done at the start, biopsy was done at the end, and for 3 months they were put on intensive lifestyle change where a low-fat whole food plant-based diet was given with soy protein, vitamin E, C, and selenium, along with the other lifestyle factors. And they found that all the participants improved weight, improved the abdominal obesity, BP and lipids were reduced, and also the gene expression changed. The genes which were promoting cancer were downregulated, the genes which were protective against cancer were upregulated, and the serum of men after the intensive lifestyle change was 8 times more effective in inhibiting prostate cancer cell growth than the controls. Again, we already know about Dr. Colin Campbell. I will urge all of you to read the book China Study in whole. And coming to quickly the summary of what China Study did. It was a largest comprehensive study on human nutrition, and it was a collaborative effort between Cornell, Oxford Universities, and Chinese Academy of Preventative Medicine. And over 62 counties from rural China were studied, and they studied the diet and other aspect of people living in that area, because these people had a much lesser incidence of chronic conditions versus the affluent population in the US. And they found that the animal protein component, when it was more than 30% of calories, was pro-carcinogenic. That means in the presence of carcinogens, the animal protein was promoting cancer. So it on its own was not probably causing cancer, but when a carcinogen was present and a high animal protein intake was present, that combination together was causing cancer more. But the same amount of plant protein was not doing the same to the cancer risk. In fact, it was reducing the cancer risk. Similarly, not all carbs are same. So unrefined carbs were increasing the risk of coronary heart disease, cancer, and other conditions, whereas whole carbs with phytonutrients, antioxidants was beneficial. A whole food plant-based diet, that means, is beneficial for a host of conditions, including cardiovascular disease, diabetes, obesity, autoimmune disease, as well as longevity. So this is a quick comparison of the diet. We can see that the Chinese counterparts were consuming a diet which was low in fat, 14.5% total calories, out of which the fiber is more compared to the American diet, and protein is optimal. So they took 64 grams of protein, whereas the Americans were taking 91 grams of protein. And the source of the protein also matters. The Chinese were taking only 0.8% calories for animal protein, whereas the Americans were taking almost 10 to 11% calories from animal protein. So when you have a low fat, high fiber, optimal protein with a minimal animal protein diet, although whatever calories you may be consuming, it is still healthier and will reduce the risk of chronic lifestyle conditions. Coming to longevity, again, we already spoke about the blue zones and the blue zone diet guidelines, depending on the commonalities in the eating pattern of the centenarians in the blue zones. So 95 to 100% plant-based eating pattern, wholly whole, so minimally processed, minimally cooked, or mostly raw. And daily dose of half cup to 1 cup beans per day. Mostly water, reducing the other beverages. And nuts can be used as snacks. Again, go easy on fish and eggs, up to less than 3 eggs per week. Reduce sugar, that is again a refined carb. To reduce dairy and to reduce meat consumption. So finally, we come to a summary of whatever we saw right now. So when it comes to obesity, a minimally processed diet which contains whole foods, complex carbs, which has low fat is beneficial to reduce obesity, whereas a diet which has more than 10% saturated fat, red and processed meat, ultra-processed foods, and sugar-sweetened beverages is not going to help us tackle obesity. When it comes to hypertension, again, the same dietary pattern is beneficial: whole grains, fruits, vegetables, lean protein, and sodium less than 1500 milligrams per day. Whereas the standard American diet with 14% or more saturated fat, red and processed meat, ultra-processed foods, high sodium, sugar-sweetened beverages will increase the risk. Coming to cardiovascular disease, again, whole food plant-based diets, whole grains, plant protein, olive oil, 5 to 7% energy from saturated fat is beneficial, whereas red and processed meat, a full fat dairy, ultra-processed foods, refined carbs, and trans fats are bad. When it comes to diabetes, healthy vegan, whole food plant-based diet, a nutrient-dense, calorie-restricted diet is beneficial, whereas processed foods, animal products, and sugar-sweetened beverages are not helpful. Low-fat, whole food plant-based diet is also beneficial for Alzheimer's as well as cancer. So overall, now we know what dietary pattern is beneficial: more plants, more unprocessed, more whole plants which contain vegetable, fruits, legumes and beans, whole grains, that is unprocessed, unpolished grains, nuts, plant seeds. All this together will give us a much better health compared to animal products, processed carbs, ultra-processed foods. So with that, I end my talk. Thank you so much.